Welcome back, guys. Many of you are really liking the recall sessions and appreciating. I thank you all a lot for commenting. It's like overwhelming. So, guys, thanks a lot, and also share it with your friends. Let's reach 2K, guys. And yes, I will come. I will do most of the questions and try to complete it by today only. Let's go, guys. Question 111. So there's a history of RTA bleeding spots and rashes over the body was seen 2 days. It was seen 2 days after the accident. What is the diagnosis of thromboembolism, fat embolism? I think air embolism was also one of the option. Air embolism. So this is also kind of like controversial. Like many people are saying it can be thromboembolism or air embolism. But I think the answer to this will be fat embolism. Yes, there is characteristically they have not mentioned that there is a fracture, but per se, I think they have mentioned RT and they have mentioned the time duration 2 days after the accident. I think the answer should be fat embolism. If there would have been any history of heart disease or something like that or DVT, then we could have thought of about thromboembolism. And I think the best answer for this will be fat embolism. So next question, question 112, neutrophilic extracellular traps. This question they had asked, identify the incorrect statement. So this is produced in sepsis produced by neutrophils in response to bacteria, contains chromatin antibacterial substances, has mitochondrial DNA. So the incorrect statement. So this is correct. Produced in sepsis, it is correct. Produced by neutrophils is also right. Neutrophils in response to bacteria is right, and they contain chromatin and antibacterial substance is also correct. So the best answer I think is this one. Mitochondrial. This has mitochondrial DNA. This is the wrong option. Question 113. A patient, TB patient came, completed his intensive phase, continuation phase, and tested negative for TB. What will be his status after he has tested negative for this? So the options are like lost to follow-up, treatment completed, or cured. So I think the answer for this will be cured because he has completed his course and also has tested negative. So the answer should be cured. Question number 114. This is a very nice question. I really like this question. Pregnant lady comes to the antenatal clinic with bleeding per vaginum, and I think the duration I don't remember exactly, but it was somewhere around 20 weeks. Which abnormal implantation is responsible for this? So options were like ovarian, tubal, internal loss. So basically, in this, they had twisted the question a little, but basically they trying to mean antepartum hemorrhage and in which of this abnormal implantation of ovarian tubal or near internal loss we will likely see antepartum hemorrhage. So I think the answer will be near internal loss because they are trying to indicate placenta previa, which is a cause of antenatal antepartum hemorrhage. So that will be the answer. Really nice question. Answer should be near internal loss. Question number 115. Doppler UHG is done at 12 to 16 weeks. Detects what? So when I marked this answer wrong, I could just see the UHG. I didn't see the Doppler part. So Doppler UHG is not, and I marked it as fetal growth restriction, but that is the wrong option because it's not used for monitoring the growth. Doppler UHG is used for placenta accreta, is used for the placenta abnormalities, and since it's 12 to 16 weeks, I think it'll be early onset placenta accreta. But I have even got this answer wrong. So this one was another good question. Question number 116. There was history of use of anticoagulants for some condition. Following image was given. Like image similar to this was given, I think. A leg was given which showed like this. So what is the anticoagulant that was? What is the drug that is responsible for this? Like rivaroxaban was there in the option. Heparin, warfarin was there. So many people are saying that warfarin will be the answer, but I think it is a case of heparin-induced thrombocytopenia, and HIT is most commonly caused by unfractionated heparin more than low molecular weight heparin. So the answer for this will be heparin. I think it is heparin-induced thrombocytopenia. Question number 117. There is a history of metallic poisoning which causes alopecia in the patient, and there is loss of eyelashes on the lateral side, that's metalosis, and nail changes. And then it was mentioned that we could confirm the diagnosis by looking at the nail findings. So, what is the answer for this? So, the answer for this will be arsenic. It's not thallium. In thallium, we get painful lesions. I think the answer for this is arsenic because we get nail changes, arches, maze line, and we get alopecia, and also we get the loss of eyelashes as well. So that will be the arsenic will be the answer. Question number 118. A base of skull image was given. Clinical history of a person is there with. I think the history. I don't remember the history exactly, but they mentioned that he had some pain in the eye, but his vision and everything was normal. Visual acuity was normal, and he is clenching of the teeth. Which nerve involvement leads to this? So I think they are trying to mean that clenching of teeth. I think they're trying to mean the involvement of trigeminal nerve. Trigeminal nerve. Clenching of teeth will be done by the muscles of mastication. That is, it will be from the mandibular branches. It will be from the mandibular branches, mandibular nerve, and that is a branch of trigeminal nerve V3. So we have to identify the trigeminal nerve in the base of skull image. But even the image was very unclear, so I don't know if you all have marked it right or not. Even I'm not sure about myself if I marked it right or not, but I think the question was for trigeminal nerve. Question number 119. Patient is there with bradykinesia, slurred speech, and drug use. So in this option, I think they had mentioned around 65 years age. So what is the drug use? Like the options were argatomine, selegiline, resergiline, donepezil, and one more option I don't remember. But among these options, the best answer I think will be resergiline. That is one of the drugs that can be used. Obviously, it's not the drug of the choice, but it can be used. The donepezil it is used in Alzheimer's, and argatomine I don't know. It is used in Alzheimer's. Donepezil is used in Alzheimer's. Resergiline can be used. Question number 120. Correct about UCHC. Urban CHC question was there. It caters up to 1.2 lakh population. Reference center for 2 to 3 UPHCs established in areas where there are no district or sub-district hospital. And I don't remember the fourth option. So this is wrong. Caters to 1.2 lakh population is wrong because it caters to 2.5 lakh population. 1.2 lakh is for rural CHCs. So, the normal CHCs for that it is 1.2 lakh. And reference center for 2 to 3 UPHCs. Actually, I have marked this and as answer, but I had come and check it, and it is not 2 to 3 UPHCs. It is actually 5 to 6 UPHCs, or 4 to 5 UPHCs. Sorry. So this will also will not be the answer. I think this is the answer to establish in areas where there are no district or sub-district hospital. Thank you, guys. Please subscribe to the channel and share it as much as possible. Let's go.